Hello everyone, and welcome to my presentation on posterior tibial tendonitis. PTT is commonly referred to as tendinopathy or posterior tibial tendon dysfunction. The latter is categorizable by stages 1 to 4, which can be seen in the first chart in my clinical pattern. Outcome measures that clinicians use to assess posterior tibial tendonitis include the Foot and Ankle Ability Measure, FAM, or the Visual Analog Pain Scale, VAS. PTT is most common in females aged 20 to 40 years old. The mechanism of injury is most commonly walking with a pronated foot, running, or change in direction sports. It can also be caused by any dysfunction in the tibial tendon, posterior tibial tendon. The aggravating factors are the same as the mechanism of injury, and the easing factors include rice and orthotic use. The 24-hour pattern is worse in the afternoon with weight-bearing activity. In your physical therapy exam, you will observe swelling over the medial ankle. You can also note posture that includes genu valgus, squinting patella, echinovalgus, pes planus, and abducted forefoot when compared to the contralateral limb. In active movement testing, you'll see pain with plantar flexion, inversion, or end range dorsiflexion eversion. With passive movement testing, you're going to have pain with dorsiflexion eversion, either of those individually or combined. With contractile unit testing, you're going to see pain and weakness or strength with plantar flexion and inversion. And honestly, the weakness or strength is going to depend on the chronicity or acuteness of the injury. With your accessory mobility, you're going to find out a lot. They'll likely have decreased subtalar eversion and intermetatarsal mobility. And if chronic, or they have a rigid flat foot, then they're generally going to have decreased accessory mobility in the ankle and all joints within the foot. Special tests include the Feast line, which is the test for pes planus, or the single raise heel leg, and you're just looking for pain with that last one. Palpation will include tenderness along the medial ankle, possible exquisite pain distal to the medial malleolus, and pain along the midfoot along the path of the posterior tibial tendon. Your differential diagnosis could include Achilles tendon pathology, because pain oftentimes radiates over the Achilles tendon, medial ankle sprain, a fracture of the calcaneus or tibia, and plantar fasciitis. Also be mindful of deep vein thromboses. Imaging, you're going to look at an MRI, which is the gold standard, but is actually rarely used. And then you can also commonly see a radiograph, which is just simply used to rule out the fracture. You're going to need to refer to a physician if signs and symptoms do not improve with conservative treatment. For physical therapy treatment, you're going to treat this similar to other tendonitis cases and treat the impairments. These could include painful reduced range of motion, balance, weakness, or pes planus. The surgical indicators include calcaneal osteotomy, which is a partial bone removal, tendon transfer with an osteotomy, which is a lengthening of the tendon with that same bone removal, or a triple arthrodesis, which is an extreme measure, and this is a fusion of the talocalcaneal, talonavicular, and calcaneocuboid joints. Thank you for listening to my presentation on posterior tibial tendonitis.